Hi, good morning, everyone, and thank you for joining us for the kickoff of Aging in Place Week 2020. I'm Tara Bauman, the director here at NAIPC, and I'm pleased to welcome you to the first of 4 live events we have scheduled for this week. In addition to this panel today, we have a discussion on keeping seniors safe using the latest technology at 2 o'clock Eastern Time, 2 o'clock Pacific Time, 5 o'clock Eastern Time, and a closing panel on Thursday focused on planning to age in place, where, when, and how to start. And we also have the Orange County chapter that I'm a part of. We're hosting a live event on Thursday at 9 a.m. Pacific Time titled What to Do When the Paycheck Ends. So if you'd like to attend any of these presentations, registration is still available for both events at ageinplace.org, or you can subscribe to NAIPC-TV on YouTube and watch it live that way. So I will go ahead and turn it over to Mary Lee Boatwright Quinn, who is our chairman of the board of the National Board of Directors and also head of the Atlanta chapter. So Mary Lee, it's all yours.
Hello, everyone. Welcome. We're so glad to have you with us today. As we know, I think the beginning of 2020, none of us knew that we would be at the end of 2020 saying that we're living through a pandemic. And that pandemic has certainly just affected so many aspects of our lives. And I think it certainly has impacted the way we think about where we live and how we age. And, you know, some of the highlights of media that you've seen recently, it's been estimated that 40% of COVID-19 deaths occurred in nursing homes and assisted livings. Long-term care operators have taken a huge financial hit with occupancy rates dropping drastically and increased expenses for PPE and testing. The pandemic has also shown a light on the workforce shortage issues we have in direct care, all of which, you know, impact how we will age in this country. And of course, none of us knows yet the impact, the long-term financial impact on so many things, including our retirement savings and our 401k. So all of these things combined, these insights that we've gained during the pandemic have really strengthened the resolve of the National Aging in Place Council chapters across the country to provide tools and resources that people need to make their own choices about how they want to age and where they want to age. Your choice is our mission. If this is your first time viewing one of our programs, please be sure to check out our website at ageinplace.org. Download a copy of our Act 3 tool to help you begin planning for successful aging in place. Today we have a great panel in place for you with lots of tools and tips on aging in place during the time of a pandemic. All of our panel members have unique expertise and knowledge, and we're excited to be sharing that knowledge with you today. So I'm going to kick off our panel, and I want to remind you just some housekeeping things. We've got a Q&A button when you scroll to the bottom of your screen. And anytime during the program, you can type in a question in that Q&A box. And when we get to the Q&A portion, we will ask your question of our panelists. So join us today doing that. Our first panelist is Laura Lafalchi. Laura is a certified senior advisor and Alzheimer's and dementia specialist. She is a trained virtual dementia tour facilitator, Parkinson's professional, and AFA certified memory screener. Laura is currently the chair of the Long Island, New York chapter of the National Aging in Place Council and is a current member of the National Board of NAIPC. Laura is the client care coordinator for Right at Home Home Care, Nassau, Suffolk. She brings more than 13 years of elder care marketing, sales, and education to the team there. Welcome, Laura.
Welcome. Thank you, Marilee. It's great to be here. Many of us, as you mentioned, do wish to remain aging in place at home, and accessing the necessary resources and external services is key to accomplishing that goal safely. National Aging in Place Council bridges that gap between the families and the trusted vetted professionals who serve them. And as a chairman of our Long Island board here, we find that most people don't know what they don't know about aging in place. Simple little tricks such as a home modification, putting in grab bars. Just this week, a shower, putting in a handheld shower attachment rather than the one going from the ceiling can really change the safety and the quality of life for our seniors. And keeping that in mind, that the professionals will be able to walk in and work with the family to optimize the safety and the quality within the home. We have companies that widen doorways, occupational therapists and physical therapists that can help with strengthening, and the occupational therapist can come in and do a full assessment of the home, things that you don't think of as where things are in cabinets, which space might be the best for somebody who has a knee problem or someone who has a back problem, why we should be putting things in different spaces. We have organizers who can show why there might be a danger having a stack of books coming off a stairwell, and how to make those things fit better and still be accessible while not causing risk and risk to danger. Home care is a big piece, and there's a lot of different types of home care. That it's not, I need someone in the home, so I have to have a home health aide or a nurse, and most people don't realize that it can start as simply as a companion, someone who can provide just a conversation, maybe play a game of cards, maybe drive if someone is still physically able to get out of the house and to enjoy the things that might be able to be taken advantage of. There's also really great services in National Aging in Place that offer destinations, what you'll find when you get there. If someone is handicapped or has an issue, where they can go safely and what they're going to find as far as accessibility when they get there. So those things are important. The home care piece, that companion stage, there are many ways that can help with that, but if someone's a veteran in some areas, they can get assistance with paying for that. Long-term care insurance, most of them will cover companion care as well. Reverse mortgages is a really important tool that sometimes has been given a bad rap, but it's so valuable to the families that they can know that that family home that they've lived in, it can actually pay them back to continue living there safely and getting the services that they might need. Medicaid and Medicare. A lot of people have the thought process that Medicare will take care of it. It'll pay for everything, and we wish that was the case, but unfortunately, Medicare doesn't pay for everything, and especially when it comes to home care, it's very minimal. It's only paid for as you're rehabilitating, and for short-term intermittent care, it's not something that's going to cover long-term. And Aging in Place, being able to have all of your services paid for, that takes planning, it takes forethought, especially with the Medicaid system in many states where there's a very large look-back period. So we should start thinking about aging in place and planning for the things that we need earlier rather than later, and never planning in a crisis. If it becomes a situation where someone is no longer safe at home, and by safe, I don't only mean physically safe. If there's isolation, if there's someone who is mentally upset or being alone and unable to connect to other people, that's a risk as well, every bit as much as the physical risk. So keeping in mind that aging in place is really aging in your desired location safely. It doesn't have to be the family home. You can age in place in an assisted living, in a retirement community. There are many naturally occurring retirement communities across the country, and they call them NORCs, so definitely look that up as well if you have a chance. In those types of communities, it's just, there's many seniors living there, and that can qualify that there can be some help and some services, as well as a meeting of the minds between the community members who live there, that they will help and look out for each other. So that can be something really important as well. If it is time to move to an assisted living or to a community that is a senior community, many 55 and over communities do offer a lot of support. You're not taking care of the maintenance of the home. You're not going to be doing the mowing of the lawn and the shoveling of the walkways during the winter. There's so many things that within a home you have to take care of, where an elder community or a 55 and over community can be so beneficial, as well as walking out the front door and having other people who are just like you right there. And we should always, no matter what community we live in, reach out to our neighbors, reach out to our fire departments and police departments. If you know of a senior living at home, if you are a senior living at home, reach out to those type of organizations, especially the fire department. They will come in, they will note that you are there, and in the situation of a pandemic, in the situation of natural disasters or weather, they will check in on you. So please don't forget to do things like that. When it comes time to move, or if it becomes time to move to an assisted living, there are really amazing services such as move managers and specialists, solution specialists, who will take the time to go view all of these places for you, so that the important things to you and the goals that you have can really truly be kept, and you can make sure that when you're moving into the best space to accomplish your goals. Reach out to places of worship and civic centers. Make sure that there are many people who know who you are, where you are, and what you might need, especially in the case of a pandemic. Many of our seniors are home, and they are afraid to leave their homes. And there has to be trusted resources, as well as community and that team. So think of it in terms of building your team. And every one of us should think in terms of that. We may need an elder law attorney. We may need a good friend. We might need someone who can do the grocery shopping or the laundry. We might need some cleaning person help. So whatever it is we need, let's make sure that we're getting it. And I wish you all a healthy, safe rest of your week. And thank you.
Thank you so much, Laura, for that great overview of the many aspects of what we need to consider when planning for aging in place. And I love your conceptualizing that as building your team. I think that's a great way. And if you have a NAIPC chapter in your area, then certainly there's lots of members there that can be a part of that team. So I'm going to introduce our next panelist. Vicki Gold is with us today. Vicki is a retired physical therapist, educator, trainer, and presenter, whose background includes numerous mind-body systems, including yoga, Pilates, Tai Chi, Alexander and Feldenkrais techniques. She recently relocated to Lenoir, North Carolina, and planning to establish a NORC in her community. Vicki's signature workshop is the ABCs of prevention and fitness at home and on the job, her own mind-body system where people learn how and why to align breath, center for improved safety, fitness, and function. Welcome, Vicki.
Thank you. And I'm ready for the next slide. So as that's happening, I want you to be aware that the intention of today's presentation is to give you a simple tool for making your everyday activities safer and more efficient. So besides doing some of the things that Laura mentioned and bringing in the appropriate professionals for modifying your home and whatever you need to have your environment be as safe as possible, there are things that you can do to manage your own physical and mental well-being. So the ABCs of prevention and fitness came from all these backgrounds that I have in yoga, Pilates, and as Mary Lee had mentioned. I'm also going to try to teach you some very basic skills that will help you stay fit and functionally independent. And of course, to answer some of your questions about safe and effective exercising. Next slide, please. So before you do any activity, I don't care if it's a physical activity or some other type of even mental project you have, the idea is to become conscious, become very conscious of what you're feeling physically and even mentally. I believe Laura mentioned how the emotional isolation or upset that some of you may be feeling by the current COVID epidemic and other things that may be going on in your life, the way you are feeling mentally can affect how you function physically. So just taking a moment to become conscious. Another thing is to learn these ABCs. So the ABCs are alignment, breathing, and centering. As you're listening to me, just take a moment to sit as straight as you can. I'm assuming most of you are sitting, and allow the body to assume the best posture possible. Become conscious of your breathing. Just let it be slow, relaxed breathing, and just let your mind focus on this particular presentation. So these ABCs evolved as a way to make very basic elements of all the mind-body systems that are out there, to make them available to everybody. It's not just for seniors, and it's not just for people who are confined to their homes right now, but truly the ABCs are for everybody. When I do my other presentations, I will say, just like you need to learn your ABCs to read and write, you need these ABCs, alignment, breathing, and centering, in order to function more optimally. And as I just said, they are an effective tool for people of all ages. Next slide, please. So alignment, when I often say, or my way of approaching teaching this is, what is it? Why is it important? How do you achieve it? Well, alignment is another word for saying good posture. And in the old days, when people would be taught about good posture, they would be taught chin in, chest out, stomach in, and you'd get a very rigid and certainly not a very appealing looking or feeling posture. So I like to encourage the use of mental imagery. If you think of lengthening and opening, try that. Just take a moment and just think lengthen, open. And what that does is it actually stimulates the core muscles. I'm sure a lot of you have heard of core conditioning, and it's those core muscles, the ones that are closest to the spine, that help us maintain an erect posture. When I say open, what that often does is help the muscles that are not necessary for good postural alignment to relax. If you think of a silk shirt hanging on a hanger, it's relaxed. So you lengthen and you get those core muscles engaged, and you open and you let the muscles, especially around the neck and shoulders, just relax. And something else that I believe Laura had mentioned was the importance of well supporting chairs. And For those of us who are very short, very often we need to put additional pillows behind our back. We need footrests. Become aware of whether or not your chair is giving you adequate support, especially in the low back area. If you have a chair with armrests that allow your arms not to be dragging down on your upper chest, that would be great. Or sitting at a table or desk is another way to take the weight of your arms off your shoulders so that you can sit with that better postural alignment. So becoming aware of good posture, you can start taking steps to support your body where it needs to be supported so you can have the best alignment possible. And why is good alignment important? It gives, when you're sitting or standing or even lying well aligned, it makes more room for the lungs to expand when you are breathing. And of course, with COVID being so impactful on the breathing system, you really want to make sure that you can take deep breaths and that the lungs have room to expand. With breathing, yes, people say, well, I always breathe. However, what I'd like you to focus on is a slow, prolonged exhalation. So I'll use the expression leaky tire. Try this. Just whether you breathe in or not first, just slowly go. I don't know if you are hearing me, but using that slow, prolonged exhalation or leaky tire exhalation, what you are doing is clearing the lungs of stale air. When you have done that, and let me back up. What that does is it helps get rid of what we call residual air, which is the air or stale air that sits in the corner of the lungs, because most of us don't take slow, deep breaths throughout the day. So this helps to clear the lungs and make room for oxygenated air. So slow, deep breathing, of course, never holding your breath during heavy exertion, and centering is just focusing on one thing at a time. Let your mind and body work together. Next video, next slide. Slowing your movement down, and something called the basic moves, where when I do presentations teaching people how to squat and stand and shift weight correctly, moving objects correctly so that you can minimize the possibility of any kind of back injury or straining to your neck, shoulders, and spine. Next slide. I want to be able to give you some simple exercises that you can do. Just sitting on the edge of a chair, getting your posture well aligned, pressing your feet through the floor, and trying to reach the back of your head through the ceiling. And of course, maintaining your breathing pattern. This is an excellent core conditioner. I mentioned squatting, standing, shifting your weight, a chair, a sturdy chair with armrests, or just leaning on a table, doing gentle push-ups. I'm going to ask to go to the next slide before I back up to this, because I want to make some points. I'm noticing my time is running out. So for any activity you do, whether it's your exercise routine, please remember, begin every activity, align, breathe, center. For additional strengthening, you can use your body as a weight, like when you're doing push-ups, or you can use something in your home for actual weight. Doing things in sets, sets of 3, maybe you can do 3 push-ups, maybe 5. Give yourself sets, and there's a lot more. You can see the slides. They will be available to you. I look forward to answering your questions, and thank you for the opportunity.
Thank you so much, Vicki, for those wonderful introduction to your ABCs of prevention and fitness. I think they were so timely. I know for myself, excuse me, during the pandemic, my anxiety level has certainly increased, and I need that reminder to have good posture and breathing for sure. So thank you so much, Vicki. Our next panelist.
You're welcome.
Our next panelist is Kay Furiosi. Mary Kay, as the founding attorney, brings over 30 years of practicing law together with her clinical background as a nurse to AZ Health and Elder Law. She has earned the board-certified patient advocate credential in addition to her bachelor's in nursing and a master's in health law. As previous counsel to healthcare providers, she is a passionate healthcare advocate. She believes that everyone has the right to control their own healthcare decisions and that their dignity should never be compromised. Mary Kay presents frequently to local professional and community groups, helping them to understand the unique legal challenges when faced with an illness, making the healthcare process understandable. She lives in the western suburbs of Chicago and enjoys spending time with her family and friends. Welcome, Mary Kay.
Welcome. Welcome. Good morning, all. Thank you for that lovely introduction, Mary Lee. Now that we've all been relaxed, now we're going to go in, we're going to talk about we've talked about how to keep our bodies healthy and safe. Now let's talk about how to keep our computers and ourselves healthy and safe from the computers. With hacks, scams, malware, and more, the internet can feel like a dangerous place these days. And the recent proliferation of devices, from smartphones, tablets, to internet-connected appliances, it's opened us all up to some greater risks. But the good news is that by taking just a small handful of security measures, we can greatly reduce our exposure to all of these threats. Your devices and any programs that communicate with the internet should be up to date to reduce the risk of attack. Most browsers update automatically, but look at the apps you use to read documents or view photos and videos you have found online. If you are using old versions of these apps, and this is important, it's likely there will be bugs that can leave your devices vulnerable. You could download a file from the internet and it could exploit one of these bugs, which is a common way people are attacked. Also, make sure you use trustworthy software from trustworthy sources like the Apple Store or Google Play. Next slide, please. Phishing scams try to exploit fear and anxiety and uncertainty, and those linked to COVID-19 are no different, particularly at this time. We get emails promising new information on the virus, and these can contain malware and links and attachment. This is a typical social engineering strategy used by scammers who reel people in by purporting to be imparting urgent information. If the phishing attacks come from cyber criminals, they are most often seeking to access devices so they can steal financial information. They can also use ransomware to lock down the device and then try to extort money to unlock it again. If you do not know the person or are not familiar with the organization that has sent the email or the message, do not click on the link or open the attachment. Also look out for any anomalies in the way the message is written. Often there can be typos or the language used just doesn't sound right. If the message purports to be from an organization you know, but you're still unsure it's authentic, go to the website rather than opening any information sent in the email. Next slide, please. Spending more time online can mean exposing more of your personal information. This is a good time to review your privacy settings. You can limit a lot of the data that Google is collecting, such as location information and the history of searches you have done by disabling that in your Google account. You can't really control what data Facebook is collecting, but you can control what people are seeing. Facebook and Google carry out unparalleled tracking of our lives online. So now could also be time to experiment with services that do not belong to the world's tech giants. There's a messaging app, Signal. It's a nonprofit alternative to Facebook-owned WhatsApp, which not only offers end-to-end encryption, which is important, but also stores, which again is important, less metadata. Next slide, please. As we're doing today, video conferencing has exploded during the pandemic as colleagues, family, and friends turn to apps which allow these large-scale group calls. Questions have been raised over how safe they are. Zoom had to retract a claim that it was end-to-end encrypted in the beginning, and Taiwan has now banned government agencies from using it on privacy and security grounds. It's worth exploring lesser-known alternatives like open source, Jitsi Meet, which does not require users to download software or create an account. For chats with a smaller group of people, it's safer to use services that have end-to-end encryption, like Signal, WhatsApp, or Wire. Next slide, please. Getting rid of accounts that you no longer use reduces data exposure. By deleting them, there is less data on you out there that reduces the privacy risks. Part of the spring cleanup should also include installing a passwords manager, which can store all of your passwords in encrypted form and generate new unique passwords that are hard to guess. Try KeepPassXC, which is open source and offline. There are also commercial services online, such as LastPass and 1Password, which offer these services for free. Next slide, please. As well as safeguarding privacy and security, it is also important to learn how to deal with the sheer volume of information coming our way as we scour the internet for answers on the pandemic. As scientists rush to better understand the virus, there's a wealth of information and disinformation circulating online about everything from supposed cures for the virus to claims that 5G technology is linked to the outbreak. Check the original source of the information you are receiving and try to verify the content with other trusted sources. Some major news organizations now have their own fact-check teams, and they send out newsletters debunking some of these stories that have gone viral. The World Health Organization also has a COVID-19 myth-busting page. And companies like Facebook and Google have said they are taking steps to counter the spread of false information. But be aware that governments may also seek to seize on the issue of so-called fake news to crack down on lawful free speech. So rumors and unsubstantiated information can run rife during Rumors and unsubstantial information can run rife during health emergency. It's important we don't add to our own and other stress by sharing false information. Above all, one of the most important things we can do to stay safe online, now and in the future, is to stand up for digital rights. Governments and companies the world over are racing to create more invasive surveillance tools in response to the pandemic. Some of these may save lives, but others may be harmful to privacy and other human rights in ways that will change our lives for years to come. Now is the time to come together and ensure that not only we, but also our human rights online survive the pandemic. So crossing the street at a busy intersection in conclusion might be scary, but if you look both ways and follow traffic signals, chances are you'll get to the opposite side of the street safely. So in conclusion, these are some of the things that you want to be aware of. Safely surf the internet, protect your security when working with emails, remember online security basics, protect your privacy and security when shopping online, handle online banking securely, use social media wisely, safeguard privacy when sharing photos online, store data, documents, and files in the cloud, customize the security settings on your smartphone or tablet. Thank you.
Thank you so much, Mary Kay. During this time when so much of our engagement with the world and with friends and family has become virtual, those tips were so timely. So thank you for the many ways that we can work to keep ourselves safe online.
My pleasure.
I certainly shared some new resources that I'm going to have to check out. So thank you, Mary Kay. Our next panelist is Amy Miller. Amy Miller is a member of the Minneapolis chapter and founded Our Family Encounter in February 2019 during the -25-degree polar vortex, when she learned from healthcare professionals the need for healthcare directives and supported decision-making for seniors. Amy creates an aging plan with her clients, allowing them to have peace of mind, knowing they can age with independence and dignity. There is a team of people who can tell them, we got this. Amy is the mom of 2 adult boys, a dog, and a cat. Welcome, Amy.
So thank you so much, Mary Lee. I really appreciate the introduction, and I'm really excited to be sharing and actually following Mary Kay, because you kind of touched on my main area, which is teleconferencing or video conferencing. So if you don't mind going to the next screen. Staying social this winter is going to probably be more important than anything you've probably ever experienced before. So there's 2 reasons why I'm going to be kind of promoting, even though there's a lot of things to be aware of when you're online, being aware, but also being on video conference could be something that really can make a difference in your life and how we're going to get through this next winter. There's 2 real main areas. One is to stay in touch, and the second is to stay engaged. Social isolation is something I think, I don't care what age you are, our kids are feeling it, we're feeling it working and not being able to see our coworkers. Our seniors are feeling it as they're doing everything at home. So one of the things I would recommend is using video conference, but not just on your computer, even though you may be watching this presentation today on your computer, it's really going to be on your cell phone. The reason why the cell phone is so important, and I'll get into this later with a video that I have playing, is that you can walk around with it. You can be in your kitchen, you can be in your bedroom, in your bathroom. That's sometimes where things happen, accidents happen. You can be while you're out shopping or playing golf. You want to be able to connect with your loved ones, with your advisors. I think everyone kind of today is talking about how do we get that team around you. But to do that, we need to have a tool to do that. So one of the things also, in addition to conferencing, having it on your cell phone, is having an email. You need an email. I know, Mary Kay, you may mention that may not be necessary, but many of the major virtual teleconferencing tools, they need an email. And I'm learning that maybe as many as half of seniors do not have an email. So if that's the case, find out what that email number is, find out what your cell phone number is, write it down in a safe place. We talk about a couple of different video conferencing tools here. Duo, FaceTime, those are already on your cell phone. Those are usually great for one-on-one, what I would say personal calls. All of these can be done for personal, they can be done for business, but the idea is some of them handle having multiple people on a call better than others. Zoom, which everyone's familiar with. Blue Jeans has actually been picked up by Verizon, so you're familiar with them. It's a US-based company. Teams and WebEx are also very common. Something you may or may not be thinking about, Thanksgiving's coming. Holidays are coming. How are you going to spend those with your family? We'll talk about that a little bit later. Another thing you can do is use it to volunteer within your local community. How do you stay in touch? If you can volunteer, that gives you something to look forward to every day. And then the other reason why this is really important is attending your doctor's appointments. And again, I will mention this a little bit later, so I hope to not repeat myself, but attending your virtual doctor's appointment, many people are holding off their appointments 12 to 18 months. You can still meet with your doctor, just be willing to do it on a video call. It's really great. Another thing also is once you're on, you're able to stay engaged. You can connect in with your local community, your schools, your neighborhood groups, offer to share some stories or how you are kind of surviving 2020. You can do it as a group amongst yourselves or with another group that you are your new friends. Be willing to share some of your skills and your talents. Do you sew? Do you knit? Do you woodwork? Those are really, it's kind of fun. You can actually do it live. So if you have a really hard knitting piece that you're trying to do, you can do that and say, see, this is how it's done. And that other person can mirror what you're doing at the same time. If you have opportunity to fix bikes or do small machine repair, share that with your neighborhood. I don't know if there's some programs called Meetup, or there's also programs called I think it's Backdoor. that will allow you to stay in touch with people in your community. And then consider taking an online class through your community education or senior community center, whatever's in your local area. Certainly Aging in Place, we can also connect you with organizations too. So with that, I'm gonna touch base back on that telemedicine topic. So you mind playing the video? My name is Amy Miller, and I'm the founder of Our Family Encounter. Do you have an emergency contact, and do they know what your wishes are? Actually, two things that I've learned. One is that about a quarter of, 26% in fact, of people facing retirement age today will be aging alone as a single or as a solo senior. Some people found that they are aging alone either by choice or by circumstance. They may have children, they just live farther away, or they're estranged, or maybe they pursued a career and just never had children. So this is going to be changing how aging is going to be needing to be supported. And many of these things are going to require that we have a plan in place and that we have documented what our choices are. So about 2 months ago, I received a text from a former neighbor of mine. And the text basically said, "Help, I need help using my phone." So I contacted him and learned that he had hurt himself. He'd been doing some work outside, and he needed to get a hold of the doctor. Well, my initial reaction was, okay, is it an emergency? He's like, oh no, it's not an emergency, not a big deal. But he does need to make an appointment with his doctor. So I got a hold of him, and then I realized I needed to actually have this conversation live on using a tool that I call a video conferencing tool that's called Blue Jeans. So in the process of doing this, I discovered that downloading an application is not something seniors are familiar with doing, and actually causes quite a bit of anxiety. Now, many people are not used to having that first time that you're on the screen. If this is something that's new to you, maybe you've used video, but you've never actually activated the video part, I'm going to challenge you to do that. It is phenomenal about what it's like to have people you've always talked to on the phone to now be able to see them. I used to work for a large global telecom company, and for years we had phone calls, conference calls, but we never ever saw each other. So I actually never met them, but I worked with them for years and years. It's absolutely fascinating how you get to know somebody just by their voice, or maybe you just get to know them by texting or emailing. So much can be, well, not as good as being in person. So much can still be communicated when you are face to face. This is really important, especially if you are going into a doctor's appointment and you have the chance of having your family members with you virtually while you're in the doctor's appointment. Sometimes when you're in that appointment, that's why I think we used to have family members go to our doctor's appointments with us, so they could be a second set of eyes and ears and could ask questions of the professionals. Now we're in a situation where we don't have that. When we send our loved ones into the clinic, we have to sit outside and wait for them to come out. And when you say, okay, how'd it go? Well, maybe they don't remember what was said. Maybe they were overwhelmed. Maybe they don't want to tell you what happened. But imagine if you could bring your own phone in and you could connect in with your family and friends because you have this video app actually on your phone. This could really transform how we stay in touch with each other. It could also be a way that you stay in touch with your friends. Maybe you're able to do a book club. Or there's a friend of mine, he gets together with his daughter and he and his wife have dinner, and his daughter also gets the ingredients and she makes dinner as well. So they're able to kind of have a Sunday meal together where they're both cooking at the same time, they're visiting, it's live, and they're able to create some new memories, even though they physically cannot be in the same place. So I'd love to hear some thoughts that you have about this. I'd also love for you to share this information with your family members, with your neighbors, with your friends, people at church, people in your senior community center. This is truly a situation where this could be an opportunity to save a life. Anything our Family Encounter can do for you, please reach out to our website at www.ourfamilyencounter.com, or you can call our number at 952-679-8332, and we will be happy to work with you on how to either create an aging plan, or we can connect you with social workers in order to how to implement your aging plan, so you are not having to go through the aging process alone. So thank you for letting me share that. I know I went a little bit over time. Kind of think about Thanksgiving. How are you going to spend Thanksgiving? And I'm going to put that kind of to all of you. What can you do to make your holiday be the best ever?
Thank you, Amy. Again, I think those tips were very, very appropriate right now. And as a healthcare professional, I definitely have seen the way telehealth has really just grown so much during this pandemic. It's been forced to grow, and so that's all good for aging in place, and I look forward to seeing how that continues to improve. And I did want to share, since you did bring that up, that one of our senior centers in Georgia, I thought, did a super creative use of Zoom by mailing out canvas and watercolor supplies, and then having an art teacher come on, and they all painted from their own home. So people are getting very creative during these times. So on to our next panelist. It's Sonia Shah. Sonia is the CEO of Pilota. She is a former founder and has worked in the innovation incubator of Fortune 7 company, United Healthcare Group, where she created and launched new products for the company. She was also featured recently in Forbes as a game changer in travel. She has received her undergraduate degree in engineering and her MBA from Cornell University. And I think she's here to speak about a unique topic today. So welcome, Sonia.
Thank you so much, Mary Lee. Yeah, I'm very excited to be here today. Going off of what Amy said, the holidays are coming up, and we've been in the middle of a pandemic for the last few months, so it's been really difficult for people to travel and see their loved ones. But with the holidays coming up, I know a lot of people are thinking about traveling, whether it's your family members coming to visit you or you going to visit someone else. And so it's really, really important, because of the state that we're in, to make sure that everybody is staying as safe as possible when making any travel arrangements. And so I'm here today to show you a really great way to make sure that you're staying safe while traveling. Instead of telling you about it, I think that the best way to do it would be just to show you exactly what it is and how to use it, so that whether it's yourself making travel arrangements or a loved one making the travel arrangements for you or to come visit you, you're able to make sure that you're all staying as safe as possible. So with that, I'm just going to share my screen. And so how it works is, if you go to our website, which is www.flypilota.com. I can put this into the chat afterwards so you don't have to remember it. You'll be taken to our website, and there you just press the button Add to Chrome. So here you'll be taken to the Chrome web store, where you then can add the Chrome extension to your browser. All you'll have to do is hit this button right here, which will say Add to Chrome. And so with this, now when you're going to look for flights or you're looking to travel, the next time that you go to shop for flights, or a loved one is going to shop for flights, you can put in your destination the way anyone normally would. Let's say I'm taking a trip from Boston to Miami. what will happen from there is we actually show you all the health and safety information that you would need to know when making this trip. So let's say I'm thinking about taking this trip because it has 5 stars here from JetBlue. If I click on these 5 stars, I can see that this is one of the safer flights that I can take, because on this flight, they are going to have good air filtration. They will provide me with PPE. They will be blocking seats. They will be capping capacities, which means there's going to be less people on the flight than they normally would be taking. They also are going to be deeply sanitizing this aircraft and will allow me to change the flight if I need to. However, if I look at the Spirit flight here, we can see that this specific flight has air filtration, but will not be providing any masks. They will not be seat blocking, which means that you might be sitting directly next to someone in the seat next to you. They also will not be capacity capping, which means that, let's say typically they have 200 people who are going to be taking the aircraft. Capacity capping means that they'll cut it down. So maybe only 60% of people will be allowed to board the aircraft. And so this flight does not include capacity capping. So that means during the holidays, you can expect that this flight will be fully booked. They also do sanitize this flight, but they don't allow for any changes. So if you don't feel safe taking the flight that day, you're not able to cancel your flight. And so with this, it makes it very, very simple to compare the different flights and itineraries and make sure that you're taking the safest flight possible, or your loved ones are taking the safest flight possible to come and visit you. We think it's really, really important, especially with the holidays, from people coming from all different places to gather together to make sure that everybody is staying safe. And with this, you can make sure that if you're staying safe within your destination, that nothing happens to you between your transit from your destination to the gathering. And so if you're really interested in booking a flight and you want to know more information about the safety procedures, so here we have this JetBlue flight. Let's say I'm very interested in booking that flight. We provide a lot of detailed information for you to make sure you're making the most informed decision possible. We provide all the information that you need to know about the health and safety about this flight, including whether or not they're going to have food hygiene policies, making sure there's less touch points between the crew and your food, social distancing during the check-in process and boarding process, etc. And so hopefully with this tool, you and your family are able to stay as safe as possible during the holiday season. As I said, it's very, very easy and simple to use. All you have to do is go to the website, hit this button here, hit this second button here, and then when you go to Google Flights to book your flights, it will all appear there. Some other additional features that may be helpful to you is in the settings for the extension, you are able to choose which policies matter most to you. So if you don't really care about being provided masks, for example, you're going to bring your own, you can always remove it and they will be removed from these here. You also can save flights. So if you're interested in booking this JetBlue flight, but you don't want to book it until next week or the week after, you can save the flight. And here you can see my list of all my saved flights for the trips I was looking at in here. And so you have a list of all the flights you were looking at, so it's easy to come back to later. Again, I'm very, very happy to share more about this. We also have videos of how to use this application, which I'm happy to send over, as well as the link to download it. So if you have any questions, feel free to reach out. Thanks. Yeah, that's all I have. So take it away, Amy.
Thank you so much, Sonia. That was wonderful. And I know what I'll be doing after this program, downloading a new app, because we're actually just in discussions about what we should do for the holidays and whether or not we're going to travel. So thank you so much. So that was a great just panel. We gave just chock full of so much information. And now it's time to do a little Q&A in the few minutes that we have left. So I'm going to ask Tara to read any questions we have from the Q&A for us. And panelists, if you want to just kind of raise your hand if you want to take the question, we'll call on you.
Well, I know I see someone answered some of the questions already, but I'll talk. The first one we'll say is Diane Watson. Hi, Diane. She asked, where should one go to report what one feels is a less than satisfactory telehealth visit? Who would be appropriate for that? Mary Kay.
Patient advocate, that's the hat I'm putting on right now. I would say the first thing I would do is I would report that to the physician, to their office. Because again, that's a billed service. Right now, Medicare is paying physicians for that. So I would reach out to their office and make that complaint first. And then my next question, again, it's like a less than, what exactly do they feel that they did not get? And maybe just simply by reaching out to the physician's office. And another way to, a really good way to communicate with the offices are with MyChart. And especially they will respond to those because they're in writing. And they're documented. So if you want to really communicate well with a physician and make sure that it's documented, MyChart's a great way, or whatever particular EMR system that particular physician or group is using. That would be my suggestion. Always start, with the provider. And then if you're not happy, obviously, you can always make complaints to, other, but I again, identify what it is that you're not happy with. And maybe it's just a lack of communication. I kind of start with it. I would start there.
Okay, thank you. And we have one more question from Diane, which is, and Laura already answered it, but I might let Laura just answer it for everyone in attendance. Do you have or recommend a tool to assess loneliness and depression? Laura, would you like to?
Sure. So I don't have a specific tool, but when seniors use phrases, or anyone for that matter at any age, saying things like, what's the point? It doesn't matter. Why bother? Those are some quick telltale signs. Unexplained weight gain or loss, that they're not on any special medications that might be causing it. There's no health concern and they're not trying to lose weight. Those can be signs as well. Some seniors who are depressed and have isolated themselves will avoid social gatherings and even decline visits from friends and family because they feel that someone's going to notice that they're detracting from life, and they don't want, they try to avoid that. So pushing your way in is not a bad thing when you see that happening to someone who's isolated. Change in overall hygiene and physical well-being and appearance is something to look out for as well. And if anyone has anything more to add to that, I'm sure there are other things that might be key phrases or red flags.
In my experience, I don't know if you're hearing me.
Yes.
In my experience as a physical therapist, sometimes just helping a person get refocused on what their purpose is. Sometimes it's just making sure they're in communication with the family members, but just identifying some kind of purpose that kind of takes their mind away from their own unhappiness. And that's if they are not having medical issues, but that's something else that could be looked at.
If I can just add, that's where the video conferencing really comes in, because that's your connection to stay safe in your home, but still be able to reach out. If you have a family member, a neighbor, a friend from your senior community center that you can connect with and talk about what your concerns are or how to stay in touch and kind of voice those concerns, having that in a live conversation on video conferencing, if you're looking for a tool, that's going to be the tool I'm going to recommend.
Thank you. And one of our attendees, Laura Kraft, typed in as well, a great assessment is the PHQ-9 questionnaire. It says it's the best tool for loneliness and anxiety that we give our participants. It asks them basic questions about their feelings, plus changes in their appearance and emotional status, I guess it's supposed to say. It got cut off. So thank you, Laura, for that. One more question. Do you have any recommendations for safely connecting beyond video conferencing as we move into the colder months? About 1/3 of our members do not have internet access or a computer. That's from the Village Connection. Amy, do you want to address that?
So it's my understanding a lot of the senior community centers have received iPads, and they're renting them out for a period of time. So you can have access to the technology. And then it's a matter of getting trained on how to use that, the tools, whether it's to make phone calls, to order your groceries, to schedule a video conference call. That's where, again, go back to the senior community centers, and we're trying to work with them on how to get you the skills on how to use that new tool.
And I have one more question here. I'll go through and make sure I didn't miss anyone. From Kat, a library student who is learning about how to address the needs of seniors, especially during this time of social distancing, and thought this event would be a great place to start. Well, thanks for joining us. I live in a small rural community that does not offer many, if any, resources for seniors. What types of resources and services can such libraries offer to meet some of the needs seniors are facing during this time? Would someone like to take that one? Laura?
1 second. Yep.
There we go.
So yes, I had just said that most libraries do offer senior services department, and they usually have educational events on a regular basis. And if you have a local aging in place organization like National Aging in Place, or, just I'm sure in most areas they have something as far as an organization for senior services, and have them help you. They can usually help in areas of mobility, accessibility, financial, legal, health, entertainment, and more ancillary services as well. If there isn't one, looking for those trusted resources to partner with is important, or starting your own National Aging in Place chapter is also a good idea and a good way to tie in to the assistance that's available in your area. Technology such as the Amazon Echo Show can be really helpful for seniors who can't leave the home and aren't tech savvy. If anyone has not seen those, they're really amazing. $49, they plug right in, and the senior doesn't have to type in anything or know anything about tech. Family and friends can just say, speak to Mary, and they're on the screen and they can talk to each other. And the senior themselves can say, I want to talk to my daughter Mary, or I want to talk to John, and it'll call for them so that they don't have to hit anything, push any buttons, or do any work. So it can be a really valuable resource as well during a pandemic when people are at home.
And I'll just add to that, Laura, that this was a great question, and I'm so pleased that you're thinking ahead about your career in library sciences. But the Older Americans Act that was passed in the 60s actually requires there to be area agencies on aging that cover every county in every state. So, and I'm certain that the area agency on aging that covers the county where a rural library is looking for a partner like the library on how to reach the seniors in that community. So I would reach out to them as well if you don't have an Aging in Place chapter in your area, because that would be a great agency to connect with and partner with.
Great. Well, thank you, everyone. I think that is all of the questions that we had. If we missed someone, I will go.
There are a few other questions, Tara, if you wanted to go through them. I see a few more there. One is, someone asked, do you have any recommendations for safely connecting beyond video conferencing in the colder months? And that 1/3 of the members that they have don't have internet access or a computer. So that's a tough one. Does anyone have any ideas on that?
That is one of the big concerns that we are hearing across the country about how to get access to the internet or a computer. I do know that there are some organizations like the Rotary has provided some equipment. Usually, and this might sound like an odd thing to suggest, especially if you are aging in place, but you do have a car, it's potentially you could go to a Starbucks and be in their parking lot and connect to their Wi-Fi. Just know that that's not a secure line. I'm just going with some real practical, low-cost solutions. But again, if you are at home, I mean, obviously, if you can call 911, you have an injury, call 911, that will always connect you in. But if you want to connect with your family and you have no other choice, but you could get to a public Wi-Fi, that's kind of why I'm making that recommendation of maybe being at a Starbucks, not to advertise for Starbucks, but a public place that has a public Wi-Fi. Or maybe there is the library. There is a way to connect with your library or the local community senior center, just not be able to go in the building, but you could be in your car. Otherwise, it is a bit of a challenge. I know churches are another possibility. They all have Wi-Fi access, believe it or not. So that's another possible place you could go.
Okay. Was there any other questions that I missed before we?
Diane Watson had a question about someone who does not wish to leave the home and the wife is having a difficult time taking care of her husband's needs with Alzheimer's. And I would say to pull in an Alzheimer's specialist in that case, because they can provide different ways of having the conversation. And sometimes it's really the spouse that needs to understand that if their loved one has Alzheimer's, maybe they don't have the capacity to make the decision of what is the safest space for them, and they might need the intervention. Finding out if they have the power of attorney or the proper legal ways to do what's best would be something that I would be considering at this time, especially if they still have capacity to be a part of the decision-making process, maybe helping them to choose their care. As far as the danger of having care staff in at this time, most agencies, our agency takes incredible steps to make sure that PPE is given. Most agencies are requiring, as well as most states, that the caregivers are tested once a week for COVID, and they would not be in your home if they have any issue. Also, arriving to work or before they begin the idea of going to work, they have to be temperature tested each day. So the precautions are being taken, and it's not as dangerous as you may think, as long as you're hiring a reputable agency that's following all of the protocols to have someone in the home for help. I hope that answers the question.
Okay, and if not, we can follow up with you, Diane, afterwards and see if we can give you a little more help. So that is all of our time for today. Thank you all so much for joining us. We actually have our first program on NAIPC-TV premiering right now on YouTube. It is a University of Maryland professor who's talking about her research related to how Alexa can improve the lives of older adults with dementia. It's actually a really interesting interview. So I hope you guys pop over there and check out some of our presentations. And thank you for joining us today. And we hope to see you at an event again soon. Thank you, everyone.